Good evening, everyone, and welcome to our Welcome Back to School Town Hall. Hopefully most of you were able to read our message last night, but again, the purpose of tonight's Town Hall is just to hopefully give out some more information as well as just some perspective on some of the health and safety protocols that we are going to have in place for full in-person learning this year at Carmel Unified School District. I want to start with just the overall goal of our health and safety protocols this year, and that is that we want to keep students in full in-person learning for the entire year. When schools get closed down, when districts get closed down, or even students get isolated or quarantined, we have uninterrupted learning, and that we know is not what's best for students. So although some of these protocols may not be advantageous for the teaching and learning cycle, they may not be what makes us comfortable as adults. They are all intended to make sure that our students stay in school in person full time. And in addition, the California Department of Public Health is the entity that gives us the mandates to help us keep school full and in person. So at every step of the way, the decisions that I will be making and that the team will be making are based on what the California Department of Public Health is mandating for our school district and for other school districts across the state. With that being said, we're doing our best to clearly communicate what we'll be doing at this time. As with the last 16 months or so, that is always subject to change. If and when it does, we will make sure that you know as soon as we do. But as I hop into a few of these safety protocols, I want to remind the group that if I miss something tonight, you need more clarification, or you have further questions, please use the chat, and I will try to get to each of those questions when I'm done with my overview. And any of those questions that we can't get to, I will be sure to either publish those or contact that individual if we know where they're coming from. But again, to kind of move on with some of our specific health and safety protocols that will allow us to keep students in person as long as possible. Probably one of the major questions we get is on masking. The California Department of Public Health requires all students to be masked when indoors, all teachers to be masked when indoors when they're in the presence of students. Masks are optional when we are outside. And if we have volunteers that come into the building in limited instances or any other non-employees, we're going to ask that they stay masked anytime they are indoors, whether vaccinated or not. And again, I will be the first one to say masks aren't necessarily, they're not going to be the best way, obviously, to educate our students. We would love to have masks off. We would love for students to be able to see our teachers' mouths. We would love for our teachers to be able to see our students' smiling faces. But again, we also want to keep students full and in person. And when our health partners are telling us that the best way to ensure that happens is to wear masks, that is guidance that we are going to follow. The state has also asked us, the CDPH has asked us to create a mask enforcement protocol. So although there is a mandate that all students have to wear masks when indoors, we are tasked with creating an enforcement protocol. The spirit of that mandate is to make sure that all kids are masked and that we've addressed that behavior or addressed students who are not masked. The state has given medical exemptions for students who cannot wear a mask. So if a student has a medical exemption, they have two options. They can wear a face shield with a drape, and that is not for any student who just doesn't want to wear a mask. Masks are better than face shields at stopping the transmission of COVID-19. So face shields with the drape are only allowed for students who have a medical condition where a mask is not practical. There is also the independent study program that we have with North Monterey County. So for students who either wearing a mask is a medical issue, or just students who feel that not being in full in-person learning is not best for their health and safety, we have that option. But with our mask enforcement protocol, I want to say first and foremost that we don't want this to be punitive in nature. But we do have an understanding that if students are in our school unmasked, they are putting the rest of their classmates at risk, and they are risking our overall mission of keeping school open full-time and full in person. So if a student arrives without a mask, we of course will give them a mask. If they lose a mask during the day, we will give them a mask. If a student continues to arrive without masks, we will talk with the parent, and we'll really try to get to the bottom of that behavior and why students are refusing to wear a mask. If a student does refuse to wear a mask, or if a student does continue to not wear a mask appropriately, at some point, in order to keep our schools open full and in person, we will consider that defiance, and defiance will be handled in a way we would normally handle defiance. We of course never want to suspend a student for something like this. We don't want to put in place other punishments, but again, if a student is jeopardizing the health and safety of their classmates, we are going to have to deal with that just as we would with any other behavior. I've also been asked by parents and staff alike, well, what are you going to do if a parent purposefully brings their student to school without a mask? And that's where I would ask you as a parent, please don't put your student in the middle of that. I'm sure none of you as parents want your child sitting in a front office on the first day of school when they should be in the classroom, building relationships with their teacher, having fun with their classmates, but instead they are sitting in the office waiting to talk with an administrator about why they won't wear a mask. So if as a parent, you have a philosophical problem with your student wearing a mask, please contact myself, please contact the Department of Public Health, but please don't put your child in the middle of an adult disagreement. They need to be in the classroom, and for the health and safety of everyone, they need to have a mask on. A couple other, moving on from masks, a couple other points. We will not be continuing the routine wellness checks that we were doing in the past. We believe that, and oftentimes this practice might have actually created a false sense of security. If you get up in the morning and you pass that health check, maybe you didn't use some of the other layered mitigation strategies because it made you feel confident that you were safe. And we know now that those health checks probably created that false sense of security. So we are not going to be conducting those anymore. However, we are still expecting that parents will keep their child home if they are exhibiting any COVID-like symptoms. If you have COVID-like symptoms, we would ask that you call the office. Someone from our health staff will be reaching back out to you as a parent, gathering more information and talking you through any quarantining or isolation procedures that you would need to go through. If a student does end up being testing positive, or they become isolated, or have those symptoms, we're going to ask that all students, and this goes for staff as well, that they not return to the school unless they've met the criteria that's set out by the California Department of Public Health. And those are having at least 24 hours that have passed since the fever has gone away, without the use of Motrin, Tylenol, any other fever-reducing medications, that their other symptoms have also improved. This is very important. That's an and. The fever has to be gone for 24 hours, and the other symptoms alongside the fever had to improve, and they have a negative COVID test, or in addition to the fever passing, the symptoms having improved, a healthcare provider has provided that documentation that the symptoms are probably from some other lying allergy or bronchitis or something else, or they've confirmed some other diagnosis that would explain those symptoms. So again, all three, either the fever has gone away for 24 hours and the other symptoms and improved, and then either they have a negative test, or a healthcare provider has got a different diagnosis or says that something else is causing those symptoms. Again, all parents, all staff, we're asking, if you're sick, if you have those COVID-like symptoms, please keep in mind that our goal is to keep our schools open for full-time in-person learning, and we need you to keep that child home. If a student gets sick at school, we will let them rest in a secluded area. We will contact the parents, and we need the parents to pick that student up immediately. Obviously, every minute that that student is in the school, there's a risk of exposure. Although they're excluded, we will have our staff monitoring, and so that puts our staff at risk. And of course, if your child is sick, we want them to be home and comfortable or with a healthcare provider. And again, once that happens, they will need to pass that CDPH guidance to return. There have been some questions about what homework, what the academic program would look like if students are sick or are sent home. As we are working towards as close to return to normal as possible, we want to move back to some of those makeup practices that we've always used. First and foremost, if your child is quarantined because they're sick, we believe they should be home resting. If they're ill, homework should hopefully not be on the top of their mind, and instead they're trying to get better. When they come back to school, we'll work with them on catching them up on missed work. Same thing if they are home because they're isolated, we'll work on that makeup work when they get back. We are not going to continue to experiment with what some call concurrent instruction, what some call simultaneous live instruction, but that idea where I'm teaching 20 kids in my classroom and I'm teaching another 5 students at home. I think educators across this country have found that you're really not doing justice to those in the classroom and you're really not doing justice to those at home. So we believe it's going to be best to go back to those traditional practices where we work on your makeup work when you get back to school and you're healthy. Quarantine and isolation guidance has been adjusted. As you might know in the past, if you were considered a close contact, so within 6 feet of someone for 15 minutes or more, you would have to isolate. One of the other advantages of having all kids in school masked is if you are both masked and you end up being a close contact with someone else, you do not necessarily just have to go home for what used to be 15 days, and in some cases could be 10, and in some cases could be 7. If you are a close contact with someone who tests positive, you now may stay in school as long as you are not COVID positive, as long as you continue to stay symptomatic, you continue to wear your mask appropriately, and that at least twice a week you undergo testing during that time, and those of course come back negative. Now you will be quarantined from extracurricular activities, including sports and those types of things, because again, our goal is to keep you full-time in-person learning as long as we can. At this time, we're not requiring staff or students to be vaccinated. I know that's another question that's on everyone's mind. We are seeing different industries in different states requiring employees to be vaccinated. At this time, we're not requiring, we are recommending that all of our staff get vaccinated, and we are not requiring students. This is again another one of those areas where I say this is our best thinking at this time. Obviously, if the state were to come forward and say that all staff need to be vaccinated, we would follow that guidance because we are following the health department guidance. If the health department comes in and says students need to be vaccinated, just like we do with measles, with mumps, with chickenpox, we will follow that health guidance and students will have to be vaccinated. But at this time, no one is requiring that students or staff need to be vaccinated in Carmel Unified. I talked a little bit earlier about the CDPH guidance. If you have a medical condition, a mental health condition, or some disability where making a mask is a problem, you can wear a face shield with a neck drape, or you can request independent study. Our staff, if there are any staff listening tonight, you could request workplace accommodations, and then we would work through that with you. On testing and vaccinations, we are currently working with various partnerships to try and make routine testing available for students and staff. For example, in my earlier example there, if you are a student who's a close contact and you need to test twice weekly so that you can stay in school, we want to make sure that that testing is easily available to you. So we're working on some partnerships to make sure that testing is readily available to anyone in our school district. And then also that if someone needs to be vaccinated and they're not sure where to go, that we have that information available for them. Again, trying to make accessibility easier for both routine testing and vaccinations. Some of the specific issues that schools are dealing with, and that as a parent you might be asking, is what does the school day look like? What does my interaction with the school look like? And the CDPH guidance suggests that schools limit non-essential visitors, volunteers, and then external activities, especially with large groups of people. So parents and guardians may drop off their children and pick them up at the classroom door. This is primarily an elementary example where parents want to come drop their student off and then get back. That is allowed, but we ask two things. One, we ask that you not enter the classroom, and we ask that you promptly enter the school grounds and then promptly leave. I can remember for years seeing parents bring their child to school, and maybe their younger students go and play on the playground, and it's an opportunity to sit there and talk with other parents. I understand that's an important part of our school culture, but we're going to ask at this point that that doesn't happen. Again, our goal, keep all students in school full-time and full in person. And so we are going to ask that you get on campus and get off. Additionally, when you're not able to bring your kid up to the classroom door, that's when we get in some of our parking situations where we have to have staggered start and end times. And I know that can be a frustration. So the easiest way to make sure that we keep drop off and pick up normal is to bring your child to the door, drop them off, and again, return promptly to your vehicle. And hopefully we'll get back very soon to those days where you can spend some time out in the parking lot or at your car talking with your neighbor. But at this point, keeping kids in school full in person has got to be our primary objective. Similar to that, we are asking that you conduct as much business as you can by phone or by email. There are going to be times where you need to come to the school and have a meeting, and we understand that. So we're asking in those circumstances that you call the office, call the teacher, and make those arrangements. But as many things as you can handle with an email and as many things as you can handle with a telephone call, we're going to ask that you do that. It's a layered mitigation strategy. The fewer person-to-person interactions that we have, the less chance we have of exposure and possible shutdowns. So again, as much as you can do virtually, that's what we're asking for. School orientations and back to school nights will occur virtually or outdoors. Again, we're trying to limit exposure. We're trying to limit any of those super spreader events. So just as we're asking parents to do what they can virtually, we as a school are going to do everything that we can, especially large group events, either virtually or outdoors, where we can get some additional spacing. You might be asking about small group meetings like PTOs or clubs. Again, we're going to do those virtually when we can, outdoors if we can. If we need to be indoors, we're going to ask that they're small. And again, any non-employee, we are going to ask that they stay masked the entire time that they are inside one of our school district buildings. Similar with classroom volunteers, we want them to be limited, but we understand there are going to be times when maybe a teacher needs a parent to come in and volunteer. And at that point, if the teacher is asking for that, we're going to consider that teacher consent. And then the volunteer, if they will provide proof of vaccination, they are able to come in and volunteer. They still need to stay masked as a non-employee. So again, for those volunteers, it's got to be teacher requested. The volunteer has to be vaccinated, and the volunteer needs to stay masked. Moving on to a few more school areas, last year's guidance on sports is currently still in effect. So indoor sports, the spectators are limited to the immediate family. We're still waiting for new guidance. So any areas, sports is a good example, where we don't have new CDPH guidance, we are going to stay with the last guidance that we were given. And then as new guidance is brought forth, we will make sure that we communicate that to you. Supplies, there were a lot of times over the past year and a half, we didn't want to use common supplies. We didn't want to have communal supplies. We'll continue to provide students with their own materials. However, in rare instances, they can be shared. And that goes for lockers, dressing out at PE and PE activities. So students can, again, secondary level, they can use their locker. the elementary level, they can share supplies. Students are allowed to use locker rooms for sports and PE. And again, as many of those PE activities and athletic activities as we can do outdoors, we will. Moving on to some of the cleaning, classrooms and other common areas will continue to be cleaned. High touch areas will obviously receive more cleaning. If there are certain parts of the building where we can't do other layered mitigation strategies, whether it's physical distancing, hand washing, some of those things will do more cleaning. The goal here is layered mitigation strategies. So as we can't do as much of one, we will increase the others. And obviously, as if there's any known exposure, we would go in and clean and disinfect the area before we brought students or staff back in. We're now learning that COVID does not transmit on surfaces and objects to the degree that I believe we once thought. So our food service will go back to normal. We're still going to try and distance students and have them eat outside. Cafeteria can be used, but I know many of our schools are creating some creative spaces for students so that they can really spread out when eating. Two areas where we're still awaiting further guidance and looking at and assessing where we're at is our performing arts classes. Any class that has forced exhalation or where you're doing something where possible particles could travel further, we want to make sure that we're doing those in the safest way possible. And so we're kind of reassessing that guidance at this point. And then field trips are also currently being reviewed, especially in light of increased transmission. We have to look at the safety of going out of state. We have to look at the safety of going to different parts of this state. And as we get more guidance from CDPH, we'll continue to update you on that as well. So that concludes my formal part. Again, I want to say our whole goal in this is keeping students in class, full-time, in person for the school year. And we will provide as many layered mitigation strategies as we can to make sure that that happens. That includes enforcing our mask policy that's mandated by the California Department of Public Health. And again, using as many strategies as we can. We will also do everything we can to provide timely communication to you as a school district. If you read my letter, I apologize profusely that this is only coming out to you less than a week before school started, but we wanted to make sure that we had as many bases covered as we could, that we were accurate in our messaging. I know one of the things that frustrated communities over the last 16 months is when a school district would send something out just to change it 2 days later. So we are going to wait until we have accurate information to communicate that out. But as this guidance changes moving forward, we'll continue to communicate out. We'll continue to have opportunities like this where you can ask questions and you can hear some context for why some of these decisions were made, not just protocols coming forward. So at this point, I'm going to pause and take a moment to look through the chat here and see if there are. I will start with some themes versus individual questions. So if you can give me just a second to read through here and see where we're at. So I see a few questions here on masks and delegated enforcement and face coverings. So again, I would just state the person in the chat is correct. School districts were delegated the ability to create their mask enforcement policy. I have clearly stated that the spirit of that mandate was not that school districts choose not to enforce the mask mandate. If the California Department of Public Health didn't want schools to be masked, they would have simply said that. They didn't. They said students had to be masked and that school districts had to choose how to enforce that, because you didn't want a health department telling a school district that they needed to suspend students, or they needed to give 3 warnings, or they needed to educate students on why masking is important. They wanted schools to decide how to enforce that. And the spirit of that mandate was not for schools to choose not to enforce that. So again, we've chose to enforce that by trying not to make it punitive, by giving out masks when they need it, working with parents, working with students. And then at the end of the day, if we feel a student's failure to follow that mandate is endangering the health and safety of others, or even worse, possibly putting us in a position where we might have to close down a classroom, a school, or the district, we're going to expect our administrators to deal with that situation. And again, I'm asking you as parents, please don't put your child in a position where we have to do that. If you disagree with this, please talk with me, please talk with the health department, but let's not put our children in the middle of that. Let's see.
A list of questions for you
Yes.
on a document. So if you'd like, I can kind of, I've parsed out the questions to just the comments. If you'd like, I can read those.
Sure, if you would like to do that, that will help me out versus scrolling.
So one of the questions was, what health partners were you referring to?
So I'm not sure the context of that question. In most of these, the health partner is the California Department of Public Health. They are the ones who are mandating much of what we have to do. And as I said, as a public school district, we will continue to follow those to make sure that our students and staff are safe.
Are staff members tested for COVID-19? And if they refuse or cannot vaccinate?
So again, we're working on those partnerships to make sure that our staff members have easy access to testing as often as they need it. If they refuse to be tested or cannot vaccinate, again, that's another reason why we have the mask mandate in place. And that is because adults have to be masked anytime they're in the presence of students. So if they refuse to test, they refuse to test. The times when that would matter is if for some reason they were out because they quarantined or they were out because they were positive. We would work with them on returning back. And if they cannot vaccinate, again, at this point, staff vaccinations are not mandatory. And so they would simply not vaccinate at this point. But again, another reason why that mask mandate is important at this point.
Capture all the ones that are rapidly coming in, but I have a few others. What ventilation systems are available as COVID-19 numbers rise / fire seasons start?
It's a great question. Many of the same systems we had in place last year, I can definitely get more information for you on that from our Director of Maintenance and Operations. I don't want to speak incorrectly. I don't know exactly what systems we have in place, but if you want to contact my office, we can certainly get you that information just as soon as possible.
Outdoor masks, meaning you are leaving it to young children to be in charge of masking outdoors and ensuring that their family wants happens. I'm baffled by the lack of outdoor masking when young children play in very close proximity outdoors, elementary school level.
Sure, yeah, so masks outdoors are optional. And so obviously for children who are old enough to make that decision on their own, if they want to have them off, they can have them off. It sounds like the spirit of the question is, what if as a parent, I want my child, maybe my younger elementary child, to have a mask on, even if they're outdoors? How do I ensure that happens? I would ask you to start with your teacher. Make sure your teacher knows and your principal knows that that is what you're wanting. And we can do our best to ensure that that happens. I also think talking with your child and making sure your child knows the importance of keeping that mask on if that's what you believe as a family.
How will we be notified if there's suspected or confirmed COVID-19 case in the classroom?
So once we have say a parent call and say, hey, my child is tested positive, or we do contact tracing and have some information, we'll send out a general correspondence, like I'm assuming we've done here in the past, as most school districts do, that says something as simple as, your child has been considered a close contact of someone who's tested positive, and here's what we need you to do. Again, If they're both masked, the good news is this year they don't have to come home. They can stay in the classroom as long as those things happen. But we will certainly have to let you know, because you'll have to keep an eye out for symptoms. You'll want to get them tested if you want them to stay in the classroom. And so you'll get a letter from us as a parent. And probably in more severe cases, we might reach out in other ways if we can't get a hold of you.
On it for contact tracing purposes, will seats be assigned in the classrooms, elementary, middle, and high schools?
I missed the start of that, but it sounds like the question was, to make contact tracing easier, are we going to use seating charts? So I think there's a couple ways to do this. I know some teachers create seating charts. I know other teachers just keep track of where students were. I've seen principals take pictures of the lunchroom at every lunch just so they know. To me, the goal in contact tracing is just to know if we get a positive case comes in, who was a close contact. And so I don't mind giving our teachers and leaders some autonomy in how they do that. But the goal is, if something happens, we need to know who a close contact was. And most teachers, 15, 16 months in now, they've created a process where they know where kids are at. And I think that's been pretty successful.
And then I know you talked about outdoor, but they're asking specifically, what's the mask protocol for lunchtime?
Sure. So for those that are eating outdoors, masks are optional, so they can keep them off. If you're eating indoors, again, we would ask that you keep your mask on when you're not actively eating, right? The goal of all of this is layered mitigation strategies. So if I'm eating indoors and I have to take my mask off temporarily to take a bite, I'm in a physical distance, or I'm going to make sure I wash my hands before I go in. I'm going to make sure I clean that lunchroom in between every class that comes in. So layered mitigation strategies, but again, we are going to do our best to make sure as many students as possible eat outside.
Quick, thank you for doing this and welcome to the district. Question, will unvaccinated teachers and staff members have to mask outside during school hours?
So if you are outdoors, masking is optional. That is whether you are vaccinated or unvaccinated. So if you are unvaccinated, you are fine to be mask-free when you're outside. If you're vaccinated, you're fine as well. So always optional. You can certainly wear them if you choose. It sounds like maybe the concern here, the underlying concern here is, if we have unvaccinated teachers outside who are unmasked, that could create a risk. And I think that's where the physical distancing comes in, and that's where being outdoors puts us at a little more limited risk.
Will bus drivers carry extra masks should a child come to school bus stop without a mask?
So I think that's a great question. And one of the things we're really excited about is to get our busing back up to full capacity. We don't have to do the physical distancing that we had to in the past because students have to wear masks when they're on the bus. So yes, schools will have extra masks, bus drivers will have extra masks. There are no shortage of masks at this point anymore. So we will have plenty of masks to give students if they forget one, or one gets lost or gets ruined or destroyed.
Already answered this, but for drop off and pickup, are teachers required to wear masks? Again, goes to the outdoors.
Yeah, not if it's outdoors. If they're greeting the students outdoors, those masks are optional.
Will they be notified if someone in our child's classroom tests positive for COVID? What about positive cases outside of our child's classroom?
Sure. So in the classroom, or out of the classroom for that matter, if you are a close contact, certainly we'll have to let you know because there's things you have to go through. If you're not deemed a close contact, but a child in your, if you're a third grade student and you're going to be in the classroom with another student all day, we're working through some of those processes. I would lean towards in one class, we probably would give you a heads up. Outside of the child's classroom, I'm not sure you wouldn't be, if this is anything like last year, that you might not be receiving multiple letters. And so we'll have to find that balance of how much communication is too much and how much is not enough. If cases continue to rise the way they are now, and we have multiple students testing positive, I'm not sure that as a parent, I would need to know every one of those, but I would probably want to know in like an elementary school where my child is in there for 7 hours a day with everyone else, I would probably want to know. So that's not a direct answer, but I would lean towards if you're going to be a close contact, absolutely. Probably in an elementary school where you're in with other students all day long, we probably need to let you know. At the secondary level, where maybe you were only in one class with them, you're not a close contact. My guess is we would inundate parents with emails, and when you send out too much communication, sometimes it becomes white noise and we don't read it as carefully as we need to. So we'll work through that, and if that changes, we'll certainly let all parents know.
Parent of an asthmatic, if they opt in for personal air filtration for her and her sibling inside the classroom, is that a potential, and despite the opening of windows during good weather?
So again, that's a question I would probably ask for you to contact us directly, and we can work with our Director of Operations and Maintenance and see what options we have. I would tell you we'll do everything we can to make sure that every student and staff member is healthy and safe. And if it's something that is possible, something we can do, something that we know is a layered mitigation strategy, we'll try and work through that. So please contact our office and we can work through that on an individual basis.
Just curious, what circumstances would create the need to disrupt in-person learning? Would that be based on state guidance, i.e. status of numbers in our area? And is there a guidance if there's a spreader event on campus? Do we know what happens in that case? What constitutes a point at which a person is disrupted?
Yes, I'm praying that doesn't happen as well. And I think that's the goal of the state and the goal of everyone is we want to keep full in-person learning. We don't want to disrupt that. And health officials believe masks are the best way to do that. If I don't know, our county numbers got so bad or a school district numbers got so bad and that guidance changed from the California Department of Public Health, if they came in and said, as sometimes health departments do, you need to close down this grade level, or you need to close down this school, or you need to close down the district, we would obviously follow that CDPH guidance as well. We're not going to cherry pick what guidance we follow. We're going to follow all of the health guidance. Most of that comes from outbreak status of what the health department would consider an outbreak and what they think they need to do to stop that from spreading further. And again, I hope that doesn't happen. The health department's goal in universal indoor masking is to try and stop that spread and hope that that does not happen.
Spiritually support rapid antigen testing 2 to 3 times a week. This is a standard practice in our old district.
So I don't think accessing the tests is a financial issue. Most of those tests, again, we're trying to partner to make sure those are readily available. So as a parent, if you wanted to get your child tested more often, or as a staff member, if you wanted to test more often, we want to make sure that that's readily available. So again, we're working on those partnerships now. I don't have an answer now, but certainly we want to make sure that access to testing is not an issue.
CUSD choose to have a higher standard than CDBH?
I would assume that might be a question like outdoor masking being optional. Could we say that outdoor masking is required? Yes, we could. Again, I'm trying to be consistent following CDPH guidance. I believe if CDPH felt that we had to do universal outdoor masking, they would mandate that. And of course, as we all know, they may change that, right? That could change. Indoor mask could go the other way. Indoor masking could become optional. It could become a local issue. They certainly could change, and we could move to a higher standard. I won't go to a lower standard. I will continue to follow the health department protocols. And if it's for some reason we would think that we would need to do more than that, that would certainly be a conversation that we would have and something that we would gather parent input on.
Contact tracing. Does close contact include kids that were close to others outdoors, unmasked, or indoors, masked, or both?
That's a great question. And I might need to look into that one a little further. What I can tell you is if they are indoors and both masked, you as the one who's would be traditionally isolated because you were close contact. You no longer have to leave school. You can stay in school again if you obviously don't have COVID, if you get a test, if you're asymptomatic. The question of if you're outdoors and unmasked, I would need to grab that. That's a great question. I would need to grab that that guidance and look through that and see if that falls back to the unmasked guidance or if unmasked outdoors is similar. So I owe you an answer to that one, and we will get that to you.
Last question here right now is, could you explain more on the adjustment of quarantine policy in the event of anyone being in close contact of COVID? What are the criteria they have to meet in order to stay in class? Will they at least need to be quarantined until the results come back negative?
Sure. So if both students in class are masked and one student becomes COVID positive, and I've been a close contact, so I've been within that person's 6-foot radius for more than 15 minutes, I can stay in school. Assuming I'm not COVID positive myself, that I'm asymptomatic. So if I'm a close contact, but I start to get COVID symptoms, I have to isolate. I have to continue to wear a mask appropriately. So if I choose not to wear a mask or I'm not keeping my mask covering my nose, they're going to have to isolate. They have to at least twice a week get tested during that 10-day period. And if at any time during that they test positive, they would obviously have to go home and quarantine. And then again, they can't do extracurricular activities. We're talking about keeping kids in school for in-person learning. So they won't have to be quarantined right away unless they're symptomatic. Or take their mask off. That's the big one. But if at any point they develop symptoms, they don't get tested, or they get tested and they're positive, then they would move to a quarantine status.
Just a quick question that came in. Just, is there any updates on the immunizations?
So we're working through that now. I know there's a few questions not only on COVID-19 vaccines, but we have students out there who are getting COVID-19 vaccines, which is then maybe throwing off the schedule of their normal immunizations. And with current changes in law, students have to be vaccinated. The medical exemptions have changed, and there is no more personal exemption for immunizations. So we are working through right now how to make sure that all students can come to school full and in person, and what it is exactly they need to do if they are not fully immunized at this point. So we are going to work with those parents. Again, if you come across that, please contact your school. We are getting consistent guidance out to all of our schools on exactly how we need to handle any student who in the past might have had a personal belief exemption or a medical exemption that's no longer valid, and how our parents know exactly what they need to do to get their child in a position to be able to start school next week. So more information on that.
Will they be tested immediately, the students? I think it's from the prior question.
So it says they have to be tested twice within 10 days. Yeah, I would think that we would make that suggestion. And as a parent, if I knew my child was a close contact, I would want to go get a test immediately. CDPH guidance says that they need to undergo at least, and I'll read this verbatim, undergo at least twice weekly testing during the 10-day quarantine. But we would certainly, when a health professional follows up with the parent, suggest that you go in and get an immediate test. But I'm not a doctor, but I'm pretty sure sometimes those tests aren't real accurate the first day or two after exposure. So I think that's why sometimes going in and getting a test right away, if it comes back negative, might be a false sense of security, which is why they want to over that 10-day period.
Then when will testing for students on campus begin?
So again, we're working on those partnerships now to try and make that access for students and staff as well. So not exactly sure when we're going to have that up and rolling, but again, the goal is to make testing as accessible as possible, as well as be able to give information that makes vaccinations as accessible as possible.
Harold is reporting that 2 students in Monterey tested positive. Are there any lessons from their experience we can learn from?
So I just heard about that today, and I understand that that is true. I haven't had time to talk with our health professionals about what might have happened there. You know, did it happen in a classroom? Did it happen in an extracurricular event? Were they masked? Did this transmission happen outside of school, in school? I would hate to comment on something that I just don't have enough information about. All right, if you can give me 1 second, I see kind of a string of questions here from one parent, and I want to make sure that I'm answering some of these. So Tricia, if you can kind of keep track of the chat and any new questions that come in, and I'm going to go through here and just kind of look at some of these questions and make sure that we're answering any of these that I can. So a lot of these questions, I think, are based on what my interpretation of masks would be, what my interpretation of what is healthy for students and what is not healthy for students, my interpretation of various law. And so, again, I would just like to reiterate, I'm not arguing the efficacy of masks. I'm not arguing whether or not educating students with masks on or off, one is better than the other. I'm not arguing about any of the actual science behind COVID or masking. I am simply saying the health professionals who we are governed by, the California Department of Public Health, has mandated that masks have to be worn. We are going to follow that guidance. I am certainly not in any position to say whether masks are effective or they're not. I can tell you in my experience in my past district and in the past state, when mandatory mask mandates came into effect, we saw a drastic decline in the number of positive students and staff in school and allowed us to open up schools. Most of our schools were closed until that mandatory indoor mask mandate came in. So in my experience, they worked. But again, I'm not a health professional. I'm not a scientist. So I'm not arguing the efficacy of masks, nor am I arguing what legally we can and cannot do, or what the FDA is or is not recalling. I am simply stating that we have a mandate from the California Department of Public Health, and we will continue to follow that. I will not sway from that. I will not change my mind on that. That is a decision that I've made, and as the superintendent of the school district and the person who is takes a great responsibility in making sure that all of our staff and students are safe, and takes great responsibility in knowing that the best thing that we can do for our students academically, as well as their mental wellness and their social emotional learning, is do everything that we can to make sure that they can stay in the classroom with their classmates, with their teacher. And the best way to do that, in my opinion, is to follow the health guidance. So I will turn it back over to you, Tricia, and see if there are any other questions that came in.
So it's kind of a question statement, you'll have to wait 3 to 5 days to do a test after exposure for the test to be accurate. I imagine you'll have a medical guidance on proceedings.
Yeah, and I think that was from that question before, why they want 2 tests during that 10-day period is a lot of times if we get that letter that says as a parent, hey, your child was a close contact, if I run and get a test right away, it might not show positive at that point. And so we want to make sure that you get a second one. And so I think maybe what the parent is asking is when the health professional, when a school nurse or a district nurse sends a letter or calls and says, hey, your student was a close contact, we could be more specific that you need to test in twice in this 10-day window. And here's what we know about testing too early. So we can, if that was the point of the question, we can certainly beef up our guidance on that when we contact parents of students who have been a close contact. All right, I will pause and see if there are any last questions. And I'll just say thank you all for joining us tonight. Any students, any staff, any parents, always appreciate the engagement, appreciate the questions. I understand this is a passionate issue for everyone. We all just want to do what is best for our children. And again, as an educator, as a parent myself, and someone who's dealt with every aspect of this pandemic over the past 16 months, I would say in my professional opinion, the most important thing we can do for students, again, is keep them in school full-time, full in person, on as close to a normal schedule as we can. And when our health partners are telling us that universal masking is the way to go, when they're telling us that students who are masked can stay in school, and that we need to limit visitors, all of those mandates are aimed at keeping kids in school. I am proud to stand and say that that's what we're going to do. So I think that that's important. And again, the health department has been clear that if you have a medical exemption, you can wear a face shield with a drape. Or if for some reason you have a medical exemption, or you just don't feel comfortable with full in-person learning, we have that independent study option. North Monterey County has a top-tier program. We all feel very comfortable letting parents know that if you're not comfortable with full in-person learning, North Monterey County will take care of you. Their independent study is top-notch. They've been doing it for years. They've been partnering with us for years. So feel very comfortable letting parents know if there's a medical condition or some reason you don't feel comfortable with that full in-person learning, we've got a great option for you with our partners. There's a last minute question. Can we switch to North Monterey County independent study at any time during the year? So technically, yes, if they get full at a certain grade level or a certain content. It might be difficult to squeeze a kid in just like any other classroom, but certainly if they have room, I'm sure they would be happy to accommodate. All right, well, again, thank you all for joining us tonight. If you have any other questions, please feel free to reach out. Again, my door is always open. If you have concerns, if you have worries or you just need to know more, please contact me directly. Be happy to sit down and chat with anyone and make sure that you fully understand why we're doing what we're doing or listen to any concerns. So thank you as always. Have a great night and be on the lookout for some meet and greets coming up as soon as we get school started. I'll be doing a meet and greet for staff and a meet and greet for parents so that I can get to know you a little more. You can get to know me. But again, we're focusing right now on trying to get our staff and students back into school, but be on the lookout for more information on that coming soon. Have a great night, everybody. Thank you.